Hello, my name is Emily Hafman. For my capstone course in MBA 590, we completed a white paper on a topic of our choosing. And today I will be presenting on this white paper, which is titled A Need for Nurses Now, Tackling the Critical Nursing Shortage. Included here is an outline of what will be covered throughout the presentation. I will be discussing the background of the nursing shortage, the problem at hand, both long-term and short-term solutions to the problem, and finally, my recommendation on how to solve this pressing issue. We are starting with the background of the nursing shortage that is being felt nationwide and specifically in the state of Wisconsin. The nursing shortage that is being faced today is nothing new, as there have been several notable shortages over the past 75 years. Most nursing shortages that occurred in the 20th century were demand-driven shortages. They were related to the increased need for registered nurses. Healthcare and nursing leaders used a trio of strategies to deal with this shortage of nurses. The first was to increase the supply of nurses by increasing the number of students admitted to nursing schools. The second was to increase the use of less educated and trained personnel, either to substitute for or to extend the work of professional nurses. The third was to shorten the educational period for nurses to produce not just more nurses, but nurses in a faster manner. At the time, these strategies were successful, but that's no longer the case. The causes related to the nursing shortage today are numerous and are issues of concern. Overall, the population is aging, with the baby boomer generation entering an age where they need more health services. In 2029, the last of the baby boomer generation will reach retirement age, resulting in a 73% increase in Americans 65 years of age and older. As the population ages, the need for healthcare services increases. The nursing workforce is also aging. There are currently 1 million registered nurses older than 50 years, meaning that 1/3 of the workforce could be at retirement age in the next 10 to 15 years. This number includes nursing faculty, which presents its own unique challenge as more than 91,000 qualified applicants were turned away from nursing school in 2021 alone. Nurse burnout and stress is another major cause. Ultimately, more nurses are leaving the profession than entering it at a rate of 15% per year. With less staff, nurses must work longer hours and take on more responsibilities, leading to increased stress and fatigue. Violence in the healthcare setting also plays a role in the nursing shortage, as the ever present threat of emotional or physical abuse adds to an already stressful environment. Job satisfaction and work effort are affected negatively as well, as the physical and emotional insults take a toll on the well being of the healthcare professional physically and emotionally. However, it's not just fellow healthcare workers that are feeling the effects of the nursing shortage, it's their patients as well. Several studies show a strong correlation between inadequate staffing and decreased quality of patient care. Improper patient care can lead to increased length of stay, infection, patient dissatisfaction, readmission, and even more alarming, increased mortality rates. Each patient that a nurse is given, each additional patient, increases the likelihood of that patient dying within 30 days of admission by 7%. Another harsh impact from the nursing shortage is longer wait times, even during life-threatening emergencies. Without adequate staff to support a healthcare facility, emergency rooms become overcrowded, leading to increased hospitalizations, procedures performed, and even permanent disability. This is causing a dangerous cycle to occur, as patient dissatisfaction, increased wait times, and poor experiences drive people to postpone or miss routine checkups and treatments. Fewer routine checkups can cause an influx of severe diseases, driving the demand for healthcare services even more. Specifically for Wisconsin, a nursing shortage has been creeping closer for years, and Wisconsin did see a nursing shortage in 2021. This is the first time that this has occurred since the early 2000s. Nurse vacancy rates also saw double-digit increases, which has not happened since 2007. This means that nursing positions are going unfilled at a rate not seen in well over a decade. Wisconsin is facing a silver tsunami, where the state's population is aging faster and prompting greater demand for healthcare services, while hospital employees in the baby boomer generation are retiring faster than new ones who currently take their place. Wisconsin is facing a deficit of more than 8,000 healthcare positions across the state today, but this shortage could swell to a deficit of more than 20,000 nurses by 2040. Despite this shortage, Wisconsin nursing programs alone turned away more than 1,000 qualified applicants per year due to a lack of nursing faculty and clinical sites. Nursing shortages are nothing new. They've been a part of American life for decades. However, the COVID-19 pandemic worsened this shortage making it increasingly urgent that strategies are coordinated to alleviate the pressures of the nursing workforce. The effects of the nursing shortage are being felt nationwide, and specifically in Wisconsin. By 2030, this nursing shortage is predicted to worsen, with close to 1 million nurses retiring and leaving the nursing profession altogether. If this problem of the nursing shortage is not fixed, not only will patients suffer, but the remaining nurses, along with hospital finances, will suffer as well. Changes need to happen, and they need to happen fast. The current state of nursing is not sustainable for patients, nurses, and hospitals alike. There have been a variety of proposed solutions to fix the nursing shortage, with some solutions being focused on the long term and some being focused on the short term. Long term solutions proposed to address the nursing shortage have been numerous, but the most significant is the recruitment and education of a larger pool of nursing students. In order to do this, funding must be provided to the educational system training these nurses. The American Association of Colleges of Nursing is advocating for federal legislation and increased funding for nursing faculty, clinical placements, and nursing program facilities so that colleges and universities have the resources to enroll and graduate more students. They also are promoting a post-baccalaureate nurse residency program to aid in nurse retention, encouraging innovation in nursing programs, including the development of fast-track programs, such as a second degree bachelor's and master's in nursing program, or even a bachelor's to doctorate program, and also working with partner organizations to highlight careers in nursing. A new workforce innovation grant program of more than 128 million was awarded by the Wisconsin Department of Workforce Development and the Wisconsin Economic Development Corporation. They're partnering with UW Green Bay, Aurora Baycare, and St. Vincent to expand the pool of nursing instructors able to teach both hard and soft nursing skills. This program is a step in the right direction, and the goal is that it will be able to be used for the whole state eventually, and then as a model for the whole nation. Another long-term solution is the utilization of nurse apprenticeship programs. This fall, Madison College is offering a first of its kind apprenticeship program that is designed specifically to address staffing shortages in Wisconsin. Apprentices will earn an associate degree in nursing through Madison College while working at UW Health Hospital during their 4-year program. They will be given full-time benefits and salaries, paid time off to attend classes, along with free college tuition, books, and supplies. Upon graduation and successful completion of the state boards, the apprentices will be hired as nurses by the UW system. There's no question that there are valid long-term solutions to this nursing shortage that are now in the early stages of implementation. They are, however, long-term. Another decade of worsening shortages will occur before the picture improves. In the meantime, strategies focusing on improving retention through improving the workforce environment and empowering nurses with emotional management skills are showing promising results. The HeartMath program is one short-term solution that has already proven to be very successful and should begin being implemented in Wisconsin. This solution teaches nurses a set of emotional management skills that help them reduce their stress in the workplace, learn skills of self-care, work and communicate more effectively in their units, and reignite their passion for nursing through a series of training and coaching sessions. HeartMath focuses on the people and training them to better handle the complexities of their work in order to improve their performance and job satisfaction. The skills that are being learned help the individuals keep their cool and take charge of a situation in real time, even when all around them is in chaos. The first hospital to utilize this program was Delnor Community Hospital in Chicago in 2000. After the first year of implementing the HeartMath program, they saw extremely promising results. Their turnover rates dropped from 26.9% to 5.9% for HeartMath trained staff, which resulted in over $800,000 in first year savings related to turnover alone. Another short term solution is to provide increased mental health support. The COVID-19 pandemic has caused and worsened an abundance of mental health problems for nurses as well. Nurses saw more death in the last 3 years than ever before. It's hard to work through trauma when they're constantly being forced to work extra. Whether it's a call line, a formal therapy session, or helping traumatized employees find a different position in the healthcare field, people need to come together and be willing to listen to those who work at the bedside to find a solution. Addressing wage disparities should also be considered. Nursing has always been a satisfying career that provides numerous intangible benefits. Remembering that nurses need to receive equally satisfying concrete rewards may provide a more lasting solution to the nurse shortage dilemma. Another short-term solution that would help is the development of a recruitment process outsourcing partner. An RPO can help healthcare systems implement workforce planning strategies to overcome the shortage. They can do this by establishing employee float pools, implementing retention strategies, building an inclusive and diverse workforce, and scaling resources as needed. One final short-term solution is hiring international nurses. During past shortages, international nurses have been brought over to help in the United States. They're a great way to invigorate a hospital's current staff. On average, most nurses have 5 to 10 years of experience before coming to the United States, and that can help bridge that gap of expertise between new grads and nurses who plan on retiring soon. It's no secret that something needs to be done about the nursing shortage. Based on several studies focusing on solutions, the most important is the retention of existing personnel. This can only be accomplished if an environment is created that enables nurses to handle the challenges of the job, cope with the stress and pressure that is inherent to it, and feel that the organization appreciates their importance and value. The HeartMath program is one solution that accomplishes these goals. Providing increased mental health support, addressing the wage disparity, utilizing RPOs, and hiring international nurses are other short term solutions that should be considered. However, the nursing shortage itself is structural in nature and requires more than short term strategies to mitigate this problem. Long term strategies, including increasing the number of nursing students through investments in nursing schools, nurse faculty salaries, and hospital training time, utilizing nurse apprenticeship programs, and enacting federal protections for healthcare workers against violence and intimidation are all valid solutions. Ultimately, organizations must take a multifaceted approach to address this problem. The nursing shortage is not going anywhere, and a comprehensive strategy of immediate and long term measures can ensure that Americans do not continue to suffer due to lack of adequate nurses. Here is a list of references that I used for this capstone paper.